Can you give us a sense of what specific impediments exist right now in federal legislation that would prevent Vermont from pursuing single payer?
Well, again, it's not pursuing single payer. In the language of the bill, there's not one word about single payer. It says give states the flexibility, maintaining at least the standards that the national bill provides in terms of who will be covered, quality of care, etc. So no word about single payer.
But what prevents us from doing that otherwise? What is in federal legislation that doesn't allow us to do that?
Oh, well, there's a lot that's in. I mean, you got a national bill that's out there. What we would have to do is, what the goal of what we are trying to do is to capture the federal money that is coming in, put it essentially into one pot, and create a more cost-effective system that guarantees health care to all people as a right. That is not the case in federal law right now.
Well, here you have a governor of Vermont who's talking about, he's been saying single payer all during the campaign, in his inauguration speech, and so on. And aren't you going to run into an insurance juggernaut in Washington? They're all going to say that if you give Vermont too much flexibility up there, you know, they're awfully close to Canada. And a lot of the conservative, pro-business Republicans are going to say, well, maybe we better not do that.
See, Canada from our
Well, you're right. I mean, the insurance industry opposed the health care bill, and they have reason to do it. Their objective is to serve their shareholders. So denying coverage on the basis of a pre-existing condition, not letting our kids stay on our policies until they're age 26, throwing you off the insurance company or the insurance you've had, and not renewing it because you got sick. That's all good business practice for them. It goes straight to their bottom line. It's a disaster for everyone else because those folks end up in our hospitals, they end up in our doctor's offices, and the cost simply gets shifted onto the taxpayer.
I know you don't think they're nice, but the question is, are they going to win?
That wasn't about them nice. That was about, that's to be determined. That's what this battle is about. We know that there are forces in the healthcare system that do well financially with the status quo, but that does real harm to the bottom line of many of our businesses that are struggling with these premiums that are going up 2 and 3 times the rate of their profit, 2 and 3 times the rate of inflation, 2 and 3 times the rate of wages. That simply is not a sustainable system. But I just want to come back to one point here. The 2014 date is quite important. And this is something I think that should appeal to conservatives. If healthcare reform is not repealed ultimately, as most people think it won't be, even if it passes in the House, then the states are going to be subject to federal law that goes into effect in 2014. And if the date where they get flexibility is 2017, it's going to mean that every state from Vermont to Mississippi will have to unwind the system that went into place for 3 years. So if there is going to be flexibility, it should coincide with the moment of decision, which is 2014.